Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Jason Bailey, and he is a board-certified pulmonologist and critical care intensivist, and he joined the staff of Northwest Health in 2021. Dr. Bailey, thank you so much for joining me today.
I'm happy to be here.
So tell me about this new procedure tool, robot.
So this is a highly advanced robotic bronchoscopy that was developed by Da Vinci. With this high-tech equipment, we can reach the very peripheral parts of the lung and biopsy very small lung nodules. It's very good in diagnosing early-stage lung cancers.
And it is minimally invasive comparative to other procedures?
Yes, that's correct. Versus a transthoracic needle biopsy, that's high risk for pneumothorax, a collapsed lung. With this device, we just go through the patient's oral airway down into the lungs, navigate the bronchial tree, reach into the far aspects within the lungs to reach these lung nodules.
And what are the risk factors for the procedure?
There is a risk of collapsed lung. However, it's much lower than if they were to have other procedures to diagnose these early stage lung cancers. And of course, we are taking tissue, so bleeding is always a possible complication, but we have ways to control that well, and of course, infection. But despite the possible risk, we hardly ever see these risks that develop after the procedure.
And is there a quick recovery?
Yes, the patient goes home the same day.
Oh, wow, that's much faster than say a traditional biopsy.
Yeah, if they were to have surgery, then they would be here for several days to, a week.
And tell me about how an ultrasound is also used during the procedure.
So we use different modalities to locate the lung nodule. You can get lost very easily navigating the bronchial tree. So we use ultrasound. We also use fluoroscopy, not to mention that we're using the CAT scan that's uploaded to the robot to navigate the bronchial tree. So as we're navigating down and we think we're at the lung nodule, then we use an ultrasound to locate the nodule to be sure that we're in the right place. And then we also use fluoroscopy to also locate the lung nodule to ensure that we're in the correct place before we start taking biopsies.
And there's a pathologist during the procedure as well?
Yeah, so as we're collecting tissue, we have the pathologist there that's also looking at the tissue that we collect underneath the microscope. And once the pathologist says, yeah, we have diagnostic tissue, then we just we start collecting as much tissue as possible so we can get all the testing that we need to make an accurate diagnosis.
And so how are you potentially diagnosing and staging the patient at the same time?
So after we do the robotic assisted bronchoscopy and collect as much tissue as we can from this lung nodule for diagnosis, then we can also use ultrasound to ultrasound the lymph nodes within the mediastinum and stick a needle in any enlarged lymph nodes for staging purposes. And so we are accurately diagnosing and staging the patient all within one setting.
So this is good for high-risk patients?
Yes, because it's minimally invasive and because it's very low risk, even patients who are on a lot of oxygen, we can still do this procedure on, and they have good results. They still usually go home the same day. The procedure itself is about between an hour and 2 hours, and we're not making any incisions or anything like that. Minimally invasive, and so even with high-risk patients, it's a low-risk procedure.
And so how is this different from, say, a traditional lung cancer screening?
So it's two separate things. This is not a screening test, it's more of a diagnostic test. So patients who are high risk for cancer, patients with a long history of tobacco dependence, they should have a screening CAT scan every year. And with the screening CAT scan, if a lung nodule is picked up, then we can do this procedure where we upload their CAT scan to the robot. The robot helps us navigate the bronchial tree down to the lung nodule, and we take several biopsies of the lung nodules for diagnosis. So it is separate from screening. It's not a screening tool, it's more of a diagnostic tool. And of course, we stage them as well. And
results are a lot faster.
We're able to get patients in very quickly. If their primary care doctor calls us today saying we have a patient with a lung mass, we will see them early next week, Monday or Tuesday, to get the workup underway. We work patients through the system very quickly, so they can get the diagnosis as quick as possible, so they can get their treatment as quick as possible. With cancer, it's patients will have a lot better prognosis. Their mortality rate's much lower if we diagnose their cancer early.
And is this just for patients in Northwest Arkansas?
No, we'll take patients from anywhere, assuming they're willing to drive to us. And so, yeah, we take all different types of insurance. And as long as they can get here to us, we will work them up and get them diagnosed and staged.
And Arkansas is considered to be a hotbed for lung cancers, lots of smokers. Can this potentially make a big difference?
Yes, absolutely. We are diagnosing cancers earlier. We're able to reach hard to reach lung nodules. It doesn't matter if the lung nodule is close to the heart border and close to the pleura or close to the major vessels. We are able to reach it with this equipment, and because of that, we don't have to wait as long to get them diagnosed.
And are you the only physician in Northwest Arkansas doing this procedure?
As of right now, I'm the only one in this whole area that's doing this procedure.
And what are you hoping that our audience will learn from this, and can they refer patients to you? Can any physician refer patients to you?
Absolutely. Any physician can refer patients to us, and I would like for them to know that we can get them in very quickly, and we will shuffle them through the system to get them diagnosed as quick as possible and right back to their physician.
Well, Dr. Bailey, I've learned so much today about this unique procedure and all that you do, and we're so grateful for all that you do for your patients and the technology and in healthcare in our state. So thank you so much for being here today.
Thank you.
And that's it for AFMC TV. Thanks for watching and have a great day.